Why does your blood pressure suddenly rise when you are stressed but drops when you stand up quickly? And how does your body control it second by second without you even noticing it? Let's break down blood pressure physiology in the simplest way as possible. Blood pressure is one of the most vital parameters of life. It reflects how effectively your heart pumps and how well your blood vessels respond. In this video, we will cover what is blood pressure, the components of blood pressure, the factors affecting it, regulation mechanism, and clinical correlations. What is blood pressure? It is the lateral pressure exerted by the column of blood on the walls of the arteries. Blood pressure is cardiac output into peripheral resistance. Components of blood pressure. Systolic blood pressure. It is the pressure during ventricular contraction. It is approximately 120 mmHg. Diastolic blood pressure. It is the pressure during ventricular relaxation. Approximately it is about 80 mmHg. Pulse pressure. It is the difference between systolic and diastolic blood pressure. Finally, the mean arterial pressure. It is the average pressure in arteries. It is the diastolic pressure plus 1/3 of pulse pressure. Next is factors affecting blood pressure. The first one is cardiac output. Cardiac output is heart rate into stroke volume. Increase in cardiac output means increase in blood pressure. Next is peripheral resistance. It is mainly determined by arterioles. Vasoconstriction causes increase in blood pressure. Vasodilation causes decrease in blood pressure. Blood volume. Increase in blood volume causes increase in blood pressure. Vessel elasticity. Loss of elasticity, that is in aging, will increases systolic blood pressure. Finally, blood viscosity. Thick blood causes increase in resistance, thereby increase in blood pressure. Next is regulation of blood pressure. First one is short-term regulation. It is rapidly acting within seconds to minutes. In that, first one is baroreceptor reflex. It works when BP is in between 70 to 150 mmHg. It is located in carotid sinus and aortic arch. It is stimulated by increase in stretch, that is increase in blood pressure. Its main response is to decrease the blood pressure and also increase the ventilation. In case of high BP, there will be increase in baroreceptor firing, decreases sympathetic activity and increases parasympathetic activity, decreases heart rate and vasodilation. If it is in case of low BP, the opposite effect, it increases the blood pressure. Next is chemoreceptor reflex. It works when BP is in the range of 40 to 70 mmHg. It is located in carotid body and aortic body. It is stimulated by hypoxia, that is decrease in oxygen, then hypercapnia, that is increase in carbon dioxide, and decrease in pH, that is acidosis. Its main response is to increase the ventilation and also increases BP via vasoconstriction. Finally, Cushing reflex. This is the CNS ischemic response. The center is in medulla. It is stimulated by increase in intracranial pressure and reduce cerebral blood flow. Next is intermediate mechanisms. It becomes active within 30 minutes to 1 hour. Here, capillary fluid shift mechanism happens. That is the stress relaxation. Finally, the long-term mechanism. It is about hours to days. Here, the renin-angiotensin-aldosterone system activates. Decrease in blood pressure will stimulate kidney to release renin. Then renin will stimulate angiotensin 1. Then angiotensin 1 activates angiotensin 2. It produces increase in aldosterone and aldosterone will cause sodium and water retention, thereby increasing the blood pressure. Next is ADH, antidiuretic hormone. It is released from posterior pituitary and it also causes sodium and water retention, thereby increasing the blood pressure. Atrial natriuretic peptide, ANP. It is produced when atria are stretched and it causes decrease in BP by vasodilation. Certain special situations, that is postural changes, standing suddenly decreases venous return, thereby decreasing the blood pressure. In exercise, there will be increase in cardiac output, so systolic blood pressure increases. Diastolic BP remains same or slightly decreases. In stress, sympathetic activation will increase the blood pressure. Clinical correlations. First one is hypertension. Persistent increase in blood pressure will lead to heart disease, stroke, kidney damage, etc. Hypertension. Low BP will cause dizziness, syncope, etc. Finally, the shock. Severe decrease in BP which causes inadequate tissue perfusion. Therefore, the blood pressure depends mainly on cardiac output and peripheral resistance. It is regulated by neural mechanism which is very fast and hormonal mechanism which is very slow. Maintaining blood pressure is very essential for the survival. If you found this video helpful, don't forget to like, share and subscribe Medic's Fortune for more simple medicine related topics. Thank you.